just a moment. Good afternoon, everyone. My name is Mike Weber. I'm the Public Health Director for Josephine County. I have with me today Sarah Rubrick, Josephine County Emergency Manager, and Dr. Kelly Burnett, Lead Medical Director for All Care. We asked everyone to come down today to formally announce that there has been the first confirmed case of COVID-19 in Josephine County. We're also come prepared to provide a bit more information than we have in the past. Namely, there have been 36 tests conducted on individuals in Josephine County to date. At present, in the nation, current count was 10,442 confirmed cases, 84 in the state of Oregon, and now 1 in Josephine County. It's important to note that this does not actually significantly change where we were yesterday. We've been saying for several weeks that it was very likely that COVID-19 was in our county. We knew this to be the case, and we've been preparing as if it was already here. So from our perspective, this doesn't change things significantly, but we do recognize that many people may be more concerned now that this confirmed case is present. That said, I'm going to hand it over to Dr. Burnett to talk a little bit about what you can do as citizens in response to this.
Good afternoon. Thank you very much. So basically, for most people, the symptoms of this illness are the same as many of the common sort of respiratory viral diseases. Really, if folks have, mild symptoms, which may include fever, cough, that you would treat this like you would any other disease, and preferably treat at home. Really where we become concerned is in the rare cases where this becomes more serious, if there's any difficulty breathing, or if you have underlying chronic diseases, if you're having more issues due to the combination of this disease and those diseases. If you need to contact your provider for medical care, at this point it is recommended that you call first for any avenue of treatment. So that would include the ER or urgent care centers as well. In many cases, we have rapidly in our area expanded our abilities to practice telemedicine, or in some cases teledentistry. And so providers are trying as much as possible to keep people out of the offices in order to decrease exposures and transmission. And many cases may be handled that way. Your provider will then determine if you need to be seen either at their office or to seek care at a higher level, such as the emergency room. Our main concern right now is trying not to overburden the medical system, and also really just trying to slow down how quickly this goes through our community in order to conserve resources in terms of hospital beds, use of medical equipment, things like that. These are in short supply, and it'll take some time to get what we need for that. In terms of testing really is only useful, again, for folks in kind of high-risk situations. If somebody needs to be admitted to the hospital and has basically ruled out for other common illnesses. Right now, influenza is still more common than this. Those tests will be done first, but if those are negative, then the hospitals will undertake the testing for coronavirus. Some primary care providers may be able to do that testing on site. Other testing is being done. It's really only for those high-risk cases where knowing the result of the testing is either going to impact treatment, or in the case of medical personnel, where that information is necessary in terms of making decisions about ability to work, things of that nature. These do require an order from a physician. If you don't have a primary care physician, then basically, again, calling first and speaking with the urgent cares would be recommended, and that can be expedited. If you are with Oregon Health Plan and have difficulties, you can also call All Care, and we can assist you with figuring that out. Really, our main efforts at this point are to, conserve, as I said, resources so that everybody can get the treatment they need, and to avoid, basically unnecessary utilization of equipment and resources. Any questions?
Was this a case of community transmission?
Do you want to do that?
We will take questions now, but before that, I do want to make some things clear. Out of respect for the patient and the patient's privacy, we will not be answering any questions about the individual itself. So that includes location, profession, age, anything that could be tied to the individual. We want to, above all else, respect their privacy. That said, I know there's going to be some questions about what we do as a follow-on to this. So this is not a new process for us. We go through what's called a case investigation. This is a normal day-to-day operation within public health for other diseases. In this case, what will happen is we will work with the patient, identify where they may have come into contact with other individuals, and we'll begin investigating and reaching out to those individuals and making them aware, and work with them to monitor and ensure that they don't develop symptoms themselves. So, it's allergies. I promise. I was hoping I'd get through one meeting without coughing. So if there are any questions that could not be used to identify the individual.
So how, I guess aggressive would you say in terms of reaching out to people, like people who've been in contact with? It's kind of just immediate, or say they've, been to the store or the gas station or things like that. Do you start contacting those places as well, or is it kind of just, like say around family members, friends, coworkers? Like how deep, I guess, do you go into that?
So casual contact is not considered a risk. So these are individuals that have had close personal contact with the individual when PPE wasn't being worn, PPE being personal protective equipment, like you'd see in a medical facility. And we'll go through this process very quickly. We have a team on hand waiting for these cases to come in, and they're going to begin doing this investigation, reaching out to people very soon.
So it's kind of just, they make a list of everyone they've had close contact with, and what's the time span that you ask?
So that's actually very difficult. We'd like to reach out to everyone within a matter of days. However, depending on the type of contact and how broad it goes, and if it crosses county lines, we work with other counties to continue that investigation into their territory.
And so I guess, sorry, what I meant was how far back do you go? Like if I were to test positive, and you want to know who I've been in contact with for how long? Like a week ago, 2 weeks ago, a month ago, or just over the last couple of days?
In this case, we believe we'll be able to identify when they came into contact, or at least a time frame. So that will put a bracket around how far back we go.
Is it possible to know if it was community transmission, since that doesn't really have to do with their personal?
We will actually release that information, but we believe we may have an answer to that, but it's still flip-flopping. There is a potential travel contact that was at play, but it wasn't direct. So we'll have to do more of the investigation before we can answer that definitively.
And in terms of testing, was it a test here at the Oregon State Laboratory, or was it a commercial testing lab?
It was a test done at the state lab.
And for, same thing, kind of for the rest of the, I believe you said 36 people who were tested, is that commercial testing as well, or is that?
That's a mix. One other thing I want to make clear, there have been 36 results. So there have been far more tests done, but we won't get those in from commercial labs until we get the final results in. So we know the tests have been done, but we won't have the definitive numbers yet.
You're saying you've done far more tests than 36?
Yes, but
36 is what again? Make sure we get that.
36 is the number of tests that we've received results back on.
Okay. All right, results only. Another one, can we say if this is at a local nursing home, or is that too specific?
That would be too specific.
I'm not sure if you, I don't think you said this, or if this is, would link it to be too identifiable, but what town? Or are you not allowed to say yet?
We won't give a geographic
Okay.
area right now.
Okay. And can you say when they were tested, or is that still kind of?
I can say we got results back. We got preliminary phone call results back last night.
Okay,
The results themselves will be posted on the OHA website tomorrow midday.
okay.
Are we able to say how long we've been testing for, just in the Josephine County area in general? How long we've started testing? And
Yes, we've been testing for a few weeks now. I won't give a specific date when we set the first one. Yes, sir.
How are they being taken care of now, this person, this one person?
We won't release information about how they're being cared for because that could be used to identify them.
I was gonna say, are we able to know if the person's at risk? But I guess that's a personal.
We may release more information later. That would only be done with the patient proving it though. Any other questions?
Mike, not necessarily regarding the announcement, but folks say a lot. I hear a lot. Oh, it's overreaction. Do you care to comment, or any of your colleagues regarding the impositions and the limits and accept the requests on the community?
So I'll give an answer and then I'll give my colleagues an opportunity if they'd like to. Allergies. I swear they're allergies. So we get that question quite often ourselves. A lot of the actions and restrictions that are being put in place are taking place at the state level, and so people are concerned that it's being done for their benefit where they're at. The reality is, the term that's been thrown around a lot, flattening the curve, is going to be critical for us. And although we may be starting some things earlier than we normally would, there is going to be a benefit to them, and they certainly aren't restrictions that we wouldn't have contemplated on our own. So everything we can do to minimize the amount of exposure and contact that you have in the community can help benefit everyone, particularly those who are at risk. So younger individuals have a tendency not to express symptoms, but they can still be contagious. And when they come into contact with people who do fall into an at-risk category, it can be a life-threatening condition for them. So everything that we're doing is appropriate. When you cough, make sure you do so in your elbow. The short answer is, I believe we're where we need to be. And we recognize that there's a hardship. We recognize that this is a challenge for people in the community. We recognize that businesses are suffering. I'm talking to a lot of them every day. Most of them are fully supportive though, and they recognize that although this is a hardship for them, it's necessary to keep others in the community safe.
In regards to flattening the curve, has there been talks about sheltering in place at this time? Or your opinions on that?
There have been conversations. We've been discussing with OHA as to when and if they want to do that. We have not gotten word from them whether that's an action they're planning on taking.
So how are we doing? How's the community doing following suggestions?
Overall, very well. There have been a handful of businesses that either failed to implement or failed to implement quickly, and we've been working with them. We have not received any pushback. No organization has been cited. There hasn't been any law enforcement action. It hasn't been needed. Overall, the community has been very supportive.
How how are individuals doing, especially those who might not have all the facts or even say it's overreacting? How's Joe Citizen doing out there?
That's a mix. We definitely hear both sides of that spectrum. So I can tell you from my perspective, I'm concerned on either end. Individuals who are underreacting, who we've heard the phrase it's just the flu, which is not true. This is far more dangerous than the flu, who continue to go out and socialize and don't maintain social distancing. That's a big concern for us because it is putting people at risk. On the other side, we have the individuals who are hoarding. They're taking resources out of the community that is preventing other people from being able to be prepared and have access to what they need. So what we need to do as a community is recognize that there is a middle ground here. We need to recognize that we need to take reasonable measures to keep ourselves and others safe. And although this may not seem reasonable to some, they truly are. If you look elsewhere in the country and elsewhere in the world, there are much, much further steps being taken. So right now, I'll say as I said before, I believe we're right where we need to be, and most citizens have been very supportive and recognize that. Did I ever-
Okay, yeah, anything from the colleagues on?
I got it, Mike, I'm sorry. I thought, did you say you were gonna be able to tell us how many tests have been done in the county?
We're releasing how many results, and we'll
Results.
continue to release those.
Okay.
And that's all tests that are being done as we get results, both positive and negative. We'll continue to release those.
So those are the results, not the total, there's still pending ones out there.
Yeah, and ultimately that's about accuracy, because in the private labs, we don't necessarily have an accurate count until the results come in. So in an effort to be accurate.
I guess one thing I would just add that, when we're done with all of this, we can look back and say, what was that all about? We have succeeded. We don't want to be like, oh my God, I wish we had acted sooner, because that means we should have acted sooner. So really, if this ends up being a nothing burger, that's because we did our job. And I think we have data, from around the world, how different countries have reacted and responded to this virus that really, shows us the sharp contrast in, early, kind of aggressive social distancing, and that's really minimized the impact on those countries in terms of, number of cases as well as, ability to have the resources needed to treat the cases that end up being serious. So. Any other questions?
What's ahead? What is, what do you do on a daily basis to, what's the county or the medical community, if you will, doing?
Well, I know for the medical community, and I can speak specifically for All Care, we're really scurrying, one, to get telemedicine in place and to have, greater access, in different modalities than our traditional face-to-face, in-person visit, so that we can continue healthcare, but it's just gonna look a little bit different for the near future. And I think this will be a boon for us actually long-term. It's kind of speeding up some processes that, we may have been lagging behind more metropolitan areas, I guess would be the best way to put it. I think, all community groups and individuals, part of this is, taking a page from, our families that went through, the Great Wars in terms of really banding together, coming together as a community to work with folks that may not have the same resources that, other businesses or individuals have. And, I've had conversations, it's about getting my garden in. I guess I still have an old bread maker from the 70s, doing things a little differently because these are different times. But I think, if we do uses resources. I'm a boomer, but I'm a tail end of the boomers, so I wasn't there personally. You know, but the kinds of community activities that happened in other times like this, I think that's really necessary. How to help our neighbors, how to help people that you may not have the same opportunities that some of us have. And again, in kind of the anti-hoarding sort of things, you know, what do we do?
How are supplies?
Should I need to answer that?
And if we can repeat the question.
Yes, the question was, how are we doing on supplies? And I'll give two answers to that. First off, there is plenty of toilet paper. Please stop buying toilet paper. The reality is, if everyone would stop hoarding toilet paper, there would be plenty for everyone. And it does not benefit you when all of your neighbors run out. So please stop. That said, overall on general care supplies, we're actually doing okay. Our supply chains are not significantly disrupted. Stores are continuing to receive goods in, and really what needs to happen is people need to be reasonable about what they're buying and how quickly they're buying it. From a public health perspective, our real concern is medical supplies. That's where we foresee problems in the near future. We have a stock of emergency supplies that have been identified by the state, and they've been distributed to the county, or they're being distributed to the county. But that is what we have. A lot of distributors are running out. We rely very heavily on China for distribution of critical medical supplies like N95 masks, gowns, and other important personal protective equipment for our medical providers. What we need right now is any organization in the community that uses those types of goods, anything that is not critical, we're asking that you please halt your day-to-day business where those goods are consumed. We need to preserve them for critical medical functions only. And we're putting together a team, a supplies task force with subject matter experts from throughout the medical community and agencies related to the medical community that are going to help decide how those goods are distributed and how they're going to be utilized and prioritized amongst the agencies throughout.
So, I spoke with someone from Asante earlier today, and they are kind of starting to have a shortage. They're not out, but they're concerned that, you know, if a lot of cases start to come in, a really big influx, that they aren't going to have enough supplies, that they're going to run out. So does Josephine County in general kind of have a plan for that in case that happens? Because she was mentioning they're being advised to reuse some masks in some cases, but masks, gloves, and gowns are like the big ones that they seem to kind of be struggling with. So do you guys have a plan in place for if, you know, this does become a lot bigger, which hopefully it doesn't, but if it does, kind of where you'll go from there?
Yes, so that task force I mentioned is going to be responsible for, first off, allocating the supplies that we have within the community. We're asking anyone who has supplies to contact us so that we can bring them into the pool, so that we can extend the usage of that personal protective equipment out further. In the meantime, we're having very serious conversations, not just within the public health department, but within those clinical communities about how we can extend and draw out those resources so that they can last as long as possible. Hopefully last long enough that we will ultimately reopen the supply chain and alleviate that burden. But it is, very truthfully, from a public health perspective, one of our larger concerns right now. So we're having conversations, we have plans with various organizations, and we're prepared, but we're prepared to make use of what limited resources we have available to us.
Are any specific numbers available? How many ventilators? How many, you know, mask, gown, you know?
We have
what
those
that
counts.
means.
We have those counts, but we aren't releasing them right now because we're still getting more information in. We're asking all medical providers in the community to do counts themselves,
Yeah.
and we're going to tabulate them and pull in all the resources we can. Renee?
I was just going to add, you know, for the public, this is part of the reason why you may notice that your dental appointments are being canceled, your elective surgery is being canceled. things that really aren't necessary for immediate continued health are being kind of pushed down the road because those procedures do utilize the supplies we need right now. And so in the meantime, brush and floss really well, take care of yourself. But, we just really need to look out for the good of the whole community at this time. In terms of, things like, prescription medications, things like that, as I mentioned last week at our press conference, right now we don't anticipate any issues with that, and we have, for all care for OHP and for Medicare, those guidelines in terms of refilling a little bit early or having, a 90-day supply instead of a 30-day supply. In general, those have all been relaxed so that people can make sure they have the medications that they need.
Can I ask you to clarify, so I'm a little confused. You said that you don't know how many tests have been taken, yet you know there's 36 that you're waiting on results for. Am I misunderstanding something?
So there's two different numbers that we're tracking. One is how many tests have been conducted, and the other one is how many results we have, because obviously there's a lag. The number of tests that have been conducted isn't as accurate for us because depending on whether information is provided to a private laboratory or whether they're sent up to the state, delays on when we get them. So the best way we can give out accurate information is to say what results we have received back.
Okay. And you know that you still have 36 you're waiting results for?
No, 36 is the number of results we
clear.
received back.
Okay, that are clear.
Yes. And one of them was positive. One thing I wanted to mention regarding the limitation on resources. So there is a process for those organizations in the community that provide critical healthcare needs to request resources back to us, and we push that request up to the state for state and federal resources. Although there is limits at both the state and federal level, that process is still in place. So for those medical communities or those medical agencies in the community, they can reach out to the County Emergency Operations Center and they can request what they need.
A little bit of a segue, but
Yes.
I don't remember if this was addressed or not, but the state reported 26 new positive cases today, and Josephine County was not on that list. Can you explain that?
Yes, so we're reporting to you prior to the state releasing the information. Tomorrow, midday, they'll update the information on the website and this case will be listed.
Can you speak to sampling versus testing?
Yes. Actually, I'm gonna let the doctor do it. Would you rather?
I'd rather you do it.
Okay, that's fine. So there's a distinction, and there's been a lot of confusion around this. So when you want to go in to get tested, if your doctor, and again, you need to go through your doctor, if your doctor determines that a test is warranted, the test isn't conducted locally. All they do is collect a sample. So there's 2 swabs involved, and when they collect the swabs, those samples are shipped off to be tested in a remote location. Those locations are either up at the state or are either up at the state or at 2 private laboratories that have provided testing to local providers. Does that clarify?
And where are samples being taken at? Just, are they at individual doctor's offices as well as maybe drive-up location or locations?
Yes, so the sample can be collected by individual physicians' offices, and anyone that's in care at the hospital can also have their sample collected there. There's another option, and this is only being extended to providers in the community. If they're unable to collect the sample for whatever reason, there's a partner in the community that's offering to support them with a drive-up option. But that still goes through your personal provider first.
There's one drive-up location in the county only?
As of now, yes. We may look at expanding that in the future, but as of now, it's matter of need.
Would you like to see more testing availability?
Yes. It would be very valuable for us to see expanded testing availability. It's not something that we have control over at the local level, though.
What's the timeline on that? we're, what's ahead regarding that? When?
We don't have good information on that. We know that it's expanding. The fact that private labs are starting to provide testing resources is a huge benefit, because that's going to expand a great deal.
Okay.
Any other questions? Dr. Manasarek, do you want to add anything? All right. Thank you very much. One last time. If you have any questions, first off, if you have general questions about COVID-19, please call 211. It's a state resource that is providing information to the general public. If you feel you may be sick, again, please call ahead to your provider or to urgent care if you don't have a personal provider. And we're continuing to put information out on Josephine County Public Health's Facebook page. And we'll keep you informed as we get more information. Thank you.